Hi, it's Dr. Lipi Roy, and welcome from a hotel in Hollywood, Florida. This is where the ASAM conference is being held. That's the American Society of Addiction Medicine. And I'm so thrilled to be attending my first live in person conference since the start of the pandemic. So nice to see other fellow attendees here in 3D or IRL in real life, for those who don't know. Um, as excited as I am, and as the organizers are and the attendees are to see each other live, ASAM wants to keep people safe, and masks are required at all ASAM events. Of course, we are also by the beach, so obviously when you're outdoors, it's safe to remove masks. But speaking of the pandemic and COVID-19, this conference is so relevant now more than ever because, unfortunately, during COVID-19 we saw drug overdose incidents and deaths increase significantly. So it is important now more than ever to understand addiction, understand drugs, people who use drugs, and keep people safe. Keep these individuals, and trust me, drugs, the attitude towards drugs in this country, in the United States, is so archaic. It is criminalized, it is backwards, it is racist. I think most people just don't understand that the vast majority of people who use drugs do so recreationally. Very, very small percentage go on to develop a substance use disorder or a drug or alcohol addiction. And if and when they do, they deserve treatment, evidence-based, compassionate treatment. So, because this is such a public health crisis, I'm going to be dedicating this entire week to the topics that are being discussed here at the ASAM conference, and I want to make sure I'm sharing all the relevant data points as well as resources with all of you. And look, the topic of addiction is actually very important to me, and yet it's one that I fell into by accident. In my first job after residency, I served as a primary care doctor to Boston's homeless population. About a year and a half or so into the job, we discovered that the leading cause of death amongst my patients was drug overdose. This is back in 2013, before we saw daily headlines of opioids and heroin and fentanyl. Um, so I learned very little actually about addiction and how to treat people with addiction throughout my medical training, my formal medical training. So I did a lot of listening. I learned from substance use counselors, therapists, psychologists, and especially my patients. I also became board certified in addiction medicine and learned a lot about the neurobiology of addiction, medications, and a lot more that I'll get into throughout the show. A key point that I learned that I want all of you to understand is that addiction is a chronic medical illness, an illness of the brain, with behavioral, genetic, and environmental impacts. Addiction is not a moral weakness or moral failing. The good news, however, is that most people with addiction, once connected to the appropriate treatment and recovery services, get better, just like people with any chronic illness: asthma, high blood pressure, diabetes, lupus, kidney disease, right? Once they're connected to a specialist, a primary care doctor, maybe a nutritionist, an oncologist, whatever the illness is, once they're connected to the right care, people get better. But with addiction, the sad reality is that most people with substance disorders or addiction, they are stigmatized, they are looked down upon, they are judged, they are treated poorly, and they don't get the treatment that they need and deserve. So for this ASAM conference, I was fortunate to be one of the faculty presenters for the Fundamentals of Addiction Medicine workshop. And my specific topic or lecture was on the neurobiology of addiction. And in future talks, I will go into more depth about how addictive substances, drugs, such as cocaine, amphetamines, heroin, oxycodone, tobacco. These substances bind parts of the brain that impair its function, and key parts of the brain that regulate and control emotion, behaviors, executive function, like the prefrontal cortex, decision making. So all of this really makes it so difficult for people who develop an addiction to quote, just stop or just say no. It just doesn't work that way. This is a kind of illness that requires actual treatment, time, care, compassion. It's available, but unfortunately, people aren't getting access to that. The workshop, Fundamentals of Addiction Medicine, also talked about harm reduction, and I'll talk a little bit more about that. Motivational interviewing techniques, screening, referral to treatment, brief intervention, referral to treatment, and the gold standard for opioid use disorder, opioid addiction, which is two medications, buprenorphine and methadone. Naltrexone also works quite well, but the sad reality is that most people don't get access to these medications. The studies actually show that buprenorphine, commercially known as Suboxone, and by the way, you're going to hear more about that later this week. And buprenorphine and methadone are two highly effective medications that are associated with a 50% reduction in mortality. And yet, very few people with opioid addiction access these medications. We need to change that. There was another lecture that will be given by somebody named Dr. Ruth Potey, who's a family medicine, addiction medicine doctor, who's going to give I'm sure, a very impassioned lecture on methadone and the history of methadone in the United States, which is very archaic and racist driven in terms of policies that prevent people from accessing this life-saving medication. And in future, I will definitely talk to you more about methadone. The reality is that countries like Canada and Portugal and Netherlands dispense methadone in pharmacies, and any doctor can prescribe it. Vans distribute it. All of it leads to low barrier access to life-saving treatment. I also want to say that, and this is going to be something I know that will come up as a theme in this conference, and that I will be sure to talk to you about, and that is harm reduction, a concept that really just tries to keep people safe. It respects people who use drugs and their decision to use drugs, respects them, and the motto of harm reduction is to meet people where they're at. And not just keep them there, help them achieve whatever their goals are, and be available to them to provide care and treatment when they are ready. It's rooted in compassion, but I'll talk far more about that. The ASAM conference this year is going to be, it's not just about opioids. We know that the drug overdose epidemic consists of polysubstance use. So other topics at this conference will be about stimulants such as cocaine and amphetamine, which are on the rise. It'll include pregnant women who need access to evidence-based treatment and compassionate treatment. Another critical theme at this year's conference will be health equity. We need to make sure that marginalized communities, including Black, Hispanic, Latinx, Native American communities, and others, get access to care, treatment, compassionate-based care and services. By the way, it's not just treatment, isn't just medications. It's counseling. It's other therapies. It's access to housing, affordable housing, education, jobs, clothes, things that I think most of us, certainly I, take for granted, right? But all of this is treatment. All of it is. Well, I just want to say that, and then another key topic is that racism is a public health crisis. We need to address racism because this certainly is something that affects my patients, and it probably affects a lot of people that you know as well, if not you yourself. So anyway, folks, I am so excited to be presenting to you from this conference about such an important array of topics and fascinating ones. I think you're going to be really find them very interesting. So tune in Wednesday, 3:00, when I'm going to be interviewing just a star in the in this space, and her name is Dr. Ayana Jordan. She's a star, all-star, rock star in the spaces of addiction, mental health, and health equity. So stay tuned for that. And in the meantime, please subscribe to my YouTube channel and follow me on Instagram at Health Humor Harmony Dr. Roy. Be safe.